Hi everyone, welcome to Dr. Ikra's Med Corner. Today we are going to discuss Norma Frontalis. So let's begin our today's lecture. When we see the skull from the anterior view, the first feature we have glabella. Glabella is a craniometric point that lies anterior aspect of the frontal bone. It's more prominent in male as compared to the female. Glabella has its own clinical importance as glabellar reflex. In the glabellar reflex, when we tap at the glabellar region, it causes blinking of the eyes. But in the normal healthy individual, when we tap at the glabellar region, they get habituated to the stimulus after 3 to 4 taps. But in the patient with the Parkinson disease and in the patient with the frontotemporal dementia, these blinking persist after 3 to 4 taps. So we can conclude that this is an abnormal primitive reflex. This reflex is normal in infants, but with the brain maturation, it disappears. Next to the glabella, we have Nasion. Nasion is formed by frontal bone and right and left nasal bone. It is located where the frontonasal suture and the internasal suture meets. Right next to the nasion, we have superior orbital fissure. Superior orbital fissure lies along the posterior wall of the orbit. It is located lateral to the optic canal and superior to the foramen rotundum. It allows the passageway of different structures, which we are going to memorize with the mnemonic. Lift and organ, lacrimal nerve, frontal nerve, trochlear nerve, abducens nerve, nasociliary nerve, and oculomotor nerve, and superior and inferior ophthalmic nerve. Below the superior orbital fissure, we have inferior orbital fissure. Inferior orbital fissure is formed by the greater wing of the sphenoid and the medullary bone. It allows the transmit of different structures, which we are going to memorize with the mnemonic sign. Zygomatic nerve, infraorbital vessels, maxillary nerve, and imaginary veins. Next, we have frontal process of maxilla. Frontal process of maxilla is projected upward, medialward, and downward, forming the lateral aspect of the nose. Below the frontal process of the maxilla, we have body of maxilla. Body of maxilla is the largest part of the bone. It is shaped like a pyramid, forming the floor of the orbit and lateral aspect of the nose and anterior aspect of the nasal cavity. Then we have the alveolar process of the maxilla. Alveolar process of the maxilla is a strong ridge that lies superior aspect of the maxilla and holding the roots of your teeth. Next, we have the alveolar process of the mandible. This is U-shaped thick structure that lodges all your lower teeth. It consists of the dental alveolus and the dental arch. It also provides the origin site for the buccinator muscle. Now here you can see the round openings on both the sides of the body of the mandible, known as ventral foramina. Ventral foramina is a small round opening. It allows the passageway of mental nerve, mental artery, and the mental branch of inferior alveolar artery. It's clinically very important as it provides the region for the placement of the dental implants. Okay, now we have the body of the mandible, also known as corpus mandibuli. Body of mandible is a thick, horizontally U-shaped, centrally located bone that forms our jawline. It allows the freedom of movement. It holds our teeth at its place. Posterior lateral to the body of mandible, we have ramus of mandible. Ramus of mandible is a quadrangular bone that lies posterior lateral to the body of mandible. The junction where the body of mandible and the ramus of mandible meets is known as groin angle. Ramus of mandible is more prominent in males as compared to the females. Now we have the preformous aperture. Piriformis aperture lies at the anterior aspect of the frontal bone. It is in pear-shaped structure. It allows the communication between the right and the left nasal cavity. At the end, we have supraciliary arches. These are smooth elevated curved structure at the squamous part of the frontal bone. They lie at the superior aspect of the supraorbital margin and inferior to the frontal eminence. So that's all for today's lecture. I hope you liked it. Thanks for watching.